So thank you all so much for joining us tonight. We really appreciate you being here for Webinar Wednesday. Tonight, we're going to be focusing on the topic of managing your whole health. And specifically, we're going to talk about top 10 tips to live better with MS. So this webinar series is brought to you by Can Do MS. And we do want to point out that this month is National MS Awareness Month. So again, thank you for joining us and being here tonight. My name is Krista Sipp, and I'm the Director of Programs here at Can Do MS. I want to take a moment to thank our generous sponsors for supporting this year's webinar series, so thank you very much. I also want to point out some other programs that we have coming up this month. Or within the next month. So we have our Jumpstart program, MS Self-Care, Caring for You and Your MS. We'll have a great multidisciplinary team on that program that can provide a lot of ideas and strategies on self-care and taking care of you and your MS. Then we have a couple of meetups this month. We have our MS Moves meetup, and then we also have our Black Community meetup. And then at the very beginning of April, I thought I'd slide this one in here since it's before our next webinar. We have our Care Partner Meetup. So any care partners that are out there, this is a program that's specifically for you, and we'd love to see you there. I will also point out our MS community programs. So we're coming to 10 different in-person locations in 2024, and we'd love to see you there. These are the next upcoming in-person programs that we have. That Columbia location is right outside of Baltimore. And then that Nashville, Tennessee program is actually in conjunction with this year's annual CMSC meeting. So please join us for that. That one is also offered virtually. So that will be a hybrid program that is both in-person and virtual. So we're really excited to have these two ladies with us. We have Jackie Rosenthal and Rachel Stakem. Jackie's a neurologist out of Georgia, and Rachel is a nurse practitioner out of New York. I'll let them introduce themselves and take the program away. Thank you both for being here today.
Hi, thank you so much. I'm happy to be here. Yes, I live in Atlanta and I'm a neurologist there. I work at the Shepherd Center, the MS Institute. So I see MS patients all day. And yeah, I think this is going to be a great talk to just give some good advice on living your best life with MS.
Hi, everyone. I'm Rachel Stakem. I'm a nurse practitioner. I work at a place called Independence Care System, which is a New York State health home and a care management organizations for people living with physical disabilities, many of which have multiple sclerosis. And I also practice 1 day a week in the South Bronx at Bronx Care MS Center. And I'm very happy to be here with you today. So I'm going to get us started. These are a list of what we're going to dive into today. There's 10 topics, which we'll go through. And without further ado, because that's a lot, I'm going to get us started on talking about mental wellness. So here we go. Okay. So when we talked about mental wellness, how we feel can affect many things. Our ability to get through a day, to maintain our relationships. And so if we look at an example like this tree here, right, there is a tree, it's it's foliage, right, and it's falling down, this could be looked at from many different ways, right? And so if you see the woman on the right, she's very angry, right? Screaming up at the tree saying, why are those leaves falling down? And I have so much work to do. And then you see the couple on the left that, are hugging and are looking up and saying, oh, what beauty there is here, right? And so it's the same scenario and very different perspectives. And so when we talk about mental or emotional wellness, what we're talking about is the ability to successfully handle the stresses of day-to-day life and to adapt to them and to get through difficult times. And so when we think about how we do that, there are some prevention strategies that can help us. For example, getting a good night's sleep, right? We all know how that can make us feel. and how if we don't get sleep, how that will make you feel. So we were just before we were getting started, we were talking about spring forward, right? And many of us lost an hour of sleep, and that I could feel the change on my body, right? Then on Monday, I was really tired, um, and that my mood was affected by that tiredness. And so if we look at like how do we go put our best foot forward, and we talk about mental wellness, getting quality sleep is really important. Exercise too can play a big role here in mental wellness. So if we exercise, and for instance, so we were talking about Monday, I'm talking about how I was feeling on Monday. I knew that if I went and exercised, I was going to feel better. And I did. And that's something that I learned, right? It's kind of in my toolbox for when I'm not feeling at my best, that's something I can do. And so those are two things to think about in regards to prevention. If I'm faced with stressors in the day, the way if I've had a good night's sleep, if I've exercised, I'm going to do a lot better. I'm going to approach things in a better space than I would have had I not done those things. And then you'll see mindfulness, right? You might have heard about this. There's a lot, it's being talked about a lot in the healthcare community. And what does that mean? It means paying attention to what's going on right this second. And that can be really hard. We often spend a lot of time thinking about what's coming up, right? Like, what do I have to do next? What's on my list? Am I ready for that? Or we're spending time thinking about what happened in the past and things that we can't change. They've already happened. And when we are looking forward and looking backwards, we're not experiencing the present moment. And it's possible to do that. It's possible to train yourself on how to focus on the present moment, and you become aware of what's going on inside you, right? Like I was telling you on Monday, I realized I'm feeling kind of down and I need to do something about it, right? So I realized what I was experiencing. And it also helps you experience what's going on around you, right? Taking in your environment, your sensations, what you're feeling. So mindfulness can be a very powerful tool. You're looking at it without judgment, just saying like, oh, I've noticed, oh, here's worry coming into my brain again. I'm worrying about what's happening next. I'm going to stay right here, right now. And sometimes people have a mantra that helps them too, right? Right now. That's what I'm going to focus on. And doing those things can really be helpful. People who are emotionally well, experts say they have fewer negative emotions and they're able to bounce back from difficulties that they may face. So this quality is called resilience, right? And we've talked about that a lot in MS, and I'm sure I am preaching to the choir as many of you are incredibly resilient, right? You had to receive a diagnosis, or your loved one received a diagnosis of MS, and that's a stressor, right? And how are you going to move forward? And you did. And learning healthy ways to cope and how to draw from resources from your community can help you build resilience. And when I was thinking about speaking to you and thinking about this talk, I was like, this is a wonderful thing, right? Because resilience is not something that we are really born with. It's that we learn, right? And we build coping mechanisms. And some of us have had really good coping mechanisms, and some of us have had to develop them, right? And work towards them because we can't figure out how to move forward. And that's really where support can come in from community resources, right? Linking to a therapist saying, I need to develop these tools. I want to learn this. And so I think this is a very empowering thing, right? If we want to figure out how to move forward and successful and go and achieve our goals, that there are these resources available to help us do that. And with that, I'm going to, the last thing I will just say is social connections, right, are really important as well. And Dr. Rosenthal is going to talk about that later and how ways to do that, but it takes a village, right? And making sure that you have people that you can rely on and speak to about your experience are really important. Things like this, right? Peer-to-peer support, people who know what you've been through is a wonderful thing to have, and that we all need our tribe, right? Our village to pull on. And so with that, I'll turn it to Dr. Rosenthal.
All right, so I'm going to talk first about pain. So pain management. Fortunately, not everybody with MS necessarily experiences chronic pain or episodic pain for that matter, but it is a common occurrence for a lot of people, and it can definitely have an impact on quality of life. So when we talk about pain in the setting of MS, some of the more common etiologies for that pain are listed here, right? So pain due to spasticity, and I'm sure that a lot of you have heard that term before. But spasticity really can present in a lot of ways. It can be, muscle stiffness, muscle spasms, jerking, aching in the muscles, difficulty moving the muscles due to that stiffness, and it can be quite uncomfortable. So that's certainly a common example of pain. We see a lot of neuropathic pain or nerve pain. So nerve pain is different from that muscle or spasticity type of pain. That can be shooting, electrical pains, sometimes itching or a burning pins and needle kind of sensation. That's a lot of the terminology that a lot of patients may use. And some examples of that we sometimes see are going to be like trigeminal neuralgia, where you can get some of that nerve pain in the face. Lhermitte's sign, for those of you that may have experienced that, when you kind of put your chin to chest and you get like that shooting electrical sensation throughout your body or a part of the body. So obviously that can impact quality of life. And musculoskeletal pain. So again, in these pains aren't necessarily unique to MS, but pain, low back pain, really common. A lot of people have that. We may see a little bit more in our MS population, joint pains and migraine. And we don't necessarily look at migraine as directly an MS symptom, but migraine is common in our MS patients, and that also can impact quality of life. And I'll say another thing is when we talk about the pain in MS, I think sometimes patients and even healthcare providers and clinicians can sometimes get really focused on what's causing the pain, and it can be very difficult to tease out where it's from. And really the most important thing is to address the pain. So what does that pain, these different kind of pains, how does that impact MS? So when pain is uncontrolled, it's going to affect sleep. It's going to impact cognition. Concentration isn't as good. Difficulty maintaining attention on tasks, maybe taking longer to carry out certain cognitive tasks. It impacts mood. It can make anxiety and depression changes related to that more pronounced, and it's going to impact your ability to, or your motivation really, to engage with the community and be social. So again, it's important to identify the pain, recognize how it's impacting your quality of life, and then manage it, right? So there's different ways to manage pain. Usually factorial way of looking at it is going to be the best way. We talked about exercise. Exercise can help with pain. In particular, it can really help with spasticity. We depend on our physical and occupational therapists as well to help manage pain. A lot of that musculoskeletal pain as well. Meditation can help. So that's in that mindfulness, some of those things we were talking about. We do use medications as well. So with medications, we really are trying to focus on the source of that pain. So using anti-spasticity medications for spasticity, using nerve pain medications for nerve pain, and interventional procedures. We use those as well for people who maybe have tried these other modalities and are still having a lot of issues. And that may be something such as Botox for spasticity management. Sometimes they'll use like a baclofen pump for spasticity management, depending on your exam and what your physical capabilities are. We've heard about like epidural steroid injections for people that maybe have issues with neck and low back pain. Again, maybe not necessarily directly related to MS, but if there's pinched nerves, for example, that can be addressed that way. And we also sometimes will see individuals that have stim devices placed to help manage these pains. So a lot of different options that can be considered. Acupuncture isn't listed, but again, that's just another treatment modality that can be entertained. And so it's important to bring it up to your healthcare team and try to get some relief, because again, we're trying to make that the quality of life is less impacted by those symptoms. Next slide. And we can go on to the next one.
Okay, that's me. So we're going to briefly talk about cognition, and I'm sure all know that we could talk about many of these topics the whole time, but we're given little snippets, right? So In cognition, we know that's very common in MS. And some of those symptoms can include like information processing. Did I understand everything I just heard? Memory, your ability to recall like where you put the keys or what or something you accomplished yesterday that you were supposed to follow up on today. Your ability to pay attention and concentrate, right? To executive functioning, like prioritize. And if you hit a barrier, like come up with another solution to what you'll do. Verbal fluency, word finding, right? I want to say something and struggling to find that word can also occur in MS. So, and Dr. Rosenthal talked about, what cognition can cause, right? So if you have pain, sometimes cognition can be impacted, and trying to tease that out can be hard. So it's really important that we're doing some screening on cognition and assessments, and using our colleagues in neuropsych to really help understand, tease out what's going on, and then remediate the symptoms. Next slide. So here's some strategies. Again, you're going to see a theme, right? Exercise is really important. Your mood, right? And if we're feeling down, it's really hard to be able to receive what's going on and to understand and to pay attention. Sleep also has impact on cognition. Pain, right? So experiencing symptoms. So really making sure we're taking as good care of ourselves, right? Getting sleep, working on our mental wellness, exercising. And then we'll look at ways to restorative activities, right? So that's really restorative is about strengthening, right? The skills. So mind game, game activities, Wordle, trying to do things that are stimulating for us is really important, right? Using our brain. And compensatory activities are also important, right? So if we know that this is not something that there is an impairment there, how can we address it? So if I have a short-term memory issue and I might forget things, I'm going to put it in appointments in my calendar on my phone so it can remind me, or I'm going to keep lists. And those are things that are working towards compensating for that loss. Next slide.
All right, so talking about achieving adequate sleep. And when we talk about sleep, it's rarely, or sleep difficulties, I'll say, it's rarely ever just one thing. There are so many different things that can impact our sleep. And so again, it does make it important to really try to take a look at what's causing problems. I'll start off by saying that generally speaking, sleep disorders are more common in MS. And what do I mean by that? So insomnia, or a problem with like your sleep wake cycle, more common in MS. Sleep apnea also is more common in MS. And with sleep apnea in particular, that can be really misleading, especially if it's maybe on the more mild to moderate side and you're not fully waking up and you're kind of maybe feel like you got 8 hours of sleep, but that sleep was never adequate or restful for you. And then restless leg syndrome and periodic limb movement disorder. These are two closely related sleep disorders where restless legs, there's kind of an urge to move the legs or a creepy crawly sensation that's alleviated by movement. And periodic limb movement disorder can sometimes be really hard to differentiate from spasticity in a lot of MS patients, but it is movements that can be diagnosed with a sleep study that occur while sleeping. You can click forward. So what are some common sleep barriers that we see in our MS population? One is nocturia. So that means having to urinate a lot during the night. Obviously, if you're having to get up frequently to empty your bladder, it may be very difficult to go back to sleep. We've talked about pain already and how that can impact sleep as well as spasticity, and then mood disorders, anxiety in particular, and I think that's something that a lot of anyone at one point in their life has experienced when you're trying to go to sleep and you can't get your mind to go to sleep with you, and you're thinking about a million and one things. And how does this impact MS? So poor sleep is going to lead to a lot of issues with daytime fatigue. So that's separate from what we think of as that typical MS fatigue, but just waking up, not feeling rested, cognitive symptoms, you talked about that, poor concentration, and just an overall lack of energy. Move forward here. So when we're looking at evaluating sleep, sometimes you do need a sleep study or a polysomnogram, and that's really important to make sure there is no underlying sleep disorder that needs to be addressed. Untreated sleep apnea in particular can be really detrimental to your health when we talk about other medical problems, like high blood pressure, for example. And it's really important too, because if that is undiagnosed and you're being treated with sleep medications, for example, you're really not getting to the root of the problem. And with sleep apnea, if you take sleep medications and that sleep apnea is untreated, that could actually be dangerous. The other thing is to work on sleep hygiene. So that's talking about like the sleep environment and your kind of sleep behaviors. With that, making sure that you're using your bed for sleep and not, doing work or watching TV. And some people can go to bed and watch TV, and I guess that message doesn't necessarily apply to them. But if you have trouble sleeping, you certainly want to try to have a very strict bedtime regimen. Avoiding things like caffeine and alcohol, within a certain period of time, because that's going to disrupt sleep as well. And then managing those MS symptoms. So if we go back and look at those common sleep barriers, if you're waking up 3 to 5 or more times a night to empty your bladder, then trying to address that separately so that's no longer a barrier to sleep. Addressing pain, spasticity, mood disorder, bringing that up to your doctor and coming up with resolutions there. And then sometimes we do need to consider pharmacologic treatments for our patients. Unfortunately, none of them are that great or work forever for a lot of people. And unfortunately, some individuals aren't ever really going to be able to achieve that what we consider as a normal sleep pattern, where you get to go to bed at 9 or 10 o'clock and sleep for 8 hours straight. And so it may mean that you have to change what your sleep looks like. Some people do have to change their bedtime. Some people do have to incorporate, maybe there's a certain time of the night where they're always up for an hour. And so you have to just adjust to that. But that's where having that sleep evaluation can really kind of dig in and see where the problem is and make sure that nothing is missed that otherwise needs to be addressed. All right.
So exercise. I was preparing for this conversation and I was like, well, everyone knows that exercise is good for you, right? So what can I share? And what I thought you might find interesting is that the CDC kind of has fine-tuned what we all should be getting. And that is about 150 to 300 minutes of moderate intensity aerobic activity. And they also say you should do about muscle strengthening twice a week. And if you're thinking like, okay, what is moderate intensity? If you want to think about your maximum, is about 220 minus your age, right? So if you're 40, 220 minus 40 is 180, and then you figure out 64 or so percent. So your heart rate should be around 115 or 136, right? So activities that are going to raise your heart rate to that level. Next slide. And so how can you do that? Oh, sorry. And just to speak about the benefit, and we know that there's many benefits in MS, right? But it's not just MS, it's about all diseases. It will impact many organs, and it improves our ability to do everyday activities. And so if you look at things, and Dr. Rosenthal is going to talk about cardiac status, exercise is wonderful on that. We also know, and studies have shown, that it can help improve and maintain cognition, right? I talked about that. We know that it reduces the risk of depression and anxiety, and it will also help us with sleep. I sound like a broken record. We also have seen studies where it helps people with MS gain strength, gain function, and endurance. I'm seeing all these people talk about on the chat all the exercise they do, which is fantastic. I also saw someone say, I can't get to the mailbox without stumbling. And of course, people who have different functional levels will need to do modify their exercise. We do work in New York City. We have some gyms that are adapted so that people in wheelchairs can work out with different functional levels. Swimming is a wonderful exercise. Many pools We'll have chair lifts that can bring you in and out. So look for adaptive exercises. I think I saw Krista also put up a resource of exercises from the Can Do program. They are out there. They're online. And so if you don't think you're not, able to do it, really reach out, see what's available for you. And if you are unsure, ask for a physical therapy evaluation for a home exercise program, so that you can figure out what you can do safely. Next slide.
All right. So relapse prevention, and a lot of the tips we're talking about today, they're really not specific to MS. They're tips that we would all benefit from. But relapse prevention is specific to our MS population. It's incredibly important. And before I dive into this too much, I'll say not everybody necessarily has what we consider relapsing MS. And so not everybody, is going to be on similar treatments or disease modifying treatments, but disease modifying treatments are what we use to reduce relapse. And that's important because we know that with reducing relapse and ideally stopping relapses from occurring, that we're able to reduce disability over time. And when we talk about relapse from, the clinician side, we're really talking about those new MS symptoms that correlate with new areas of inflammation or lesions that occur anywhere within your central nervous system. Or really, even if those areas or inflammatory attacks are occurring, even if you don't necessarily have immediate symptoms, that's what we are really working to stop, to halt, to allow that disability progression to not progress, to move in a more favorable way. So again, less relapse is what leads to less inflammation. It's going to reduce disability progression and disability over time. And it's also going to lead to less MS related symptoms over time. I do have this little diagram here, which isn't perfect. We're still learning so much about the natural history of MS and how it evolves over time and how different it is between different people. But the takeaway here is that for most people with relapsing MS, a lot of those relapses where you're having these new inflammatory attacks into your brain or spinal cord or optic nerves tend to occur more frequently early on in the disease course. And early on varies for a lot of people. It may be 10 years or 15 years, it may be 5 years. Again, that part really varies, but that's where we really need to be most aggressive at stopping those relapses so that we can try to lessen that disability. Fortunately, we have over 20 different FDA-approved therapies, and this is good because it affords us the ability to try to have a very low threshold for changing treatments if we need to, so that we can achieve that that from relapses from occurring. But now we're also able to take into account what you need as a patient, what your preferences are, what works with your lifestyle, while also achieving that goal. For people who maybe aren't having relapses anymore, or really weren't having as many relapses, then we may not have to use these disease modifying treatments. I know another kind of hot topic are when does someone come off of treatment? And so that would be different if you're no longer in that inflammatory phase of the MS. You may not need those treatments. But other things to work on separate from that are going to be just lifestyle modifications, which again, we've talked about all of these, looking at, we will hear more about a well-balanced diet, but regular exercise and whatever that looks like for you based on your functional capacity. And then stress management is important as well. Go to the next slide.
So Dr. Rosenthal set me up here very nicely, talking about nutrition. So I wanted to point out, because I don't think we always think about this, that what we put into our bodies, what we're eating, is like medicine, right? Because the nutrients that our body gets largely is from the food that we eat. And so it is really important to get access, as Dr. Rosenthal said, this is true for everybody, right? With or without MS, that we're getting high quality nourishment. It's essential for our well-being. What we know in MS that's true is that the diet affects the gut biome, right? That bacteria that live in the gut, which in turn has important effects on the immune system. And we believe that's relevant for MS. What we can see in the literature on nutrition is that half of Americans have one or more preventable chronic disease, and many of those things are related to poor quality eating patterns and physical inactivity, right? So lack of movement and not eating highly nutrient food. And so what I'm talking about there is like hypertension, heart disease, diabetes. And so when we're making those choices, when we can, right, to say, because I understand sometimes it can be really hard, but to make sure that we are eating as well as, making sure we're having high protein, that we're having a lot of green leafy vegetables, that we're having fruit. And so usually the next question after we say that is, okay, what diet should I be on? And right now, there's not enough evidence to definitively say this is the right one. So a well-balanced meal. However, I will tell you, just because I thought this was exciting to see, Dr. Katz and her colleagues at Mount Sinai did a study on the MIND diet, which was published a couple of years ago. And the MIND diet focuses on, it's a combination of the Mediterranean diet and the DASH diet, which is the dietary approaches to stop hypertension, right? It's like a low salt specific diet. So those two diets combined, and the study suggested that those people who were in it, the researchers found that those who ate more healthy components of the MIND diet and less unhealthy components tended to have more preserved brain tissue in the thalamus, right, which is a critical relay station in the brain. They also reported that higher intake of full-fat dairy products was associated with fewer MS lesions, which was really interesting, and that the consumption of omega-3 fatty acids from fish was associated with a greater structural integrity of other areas of the brain. It was a small study. It's looking at newly diagnosed, so it's a very limited, but it's promising, right? And that the team over there is continuing to do this work. But I think, if you were going to say the Mediterranean, the DASH diet, two very good diets that are well balanced. And so something to think about as you pick your food, right? Next slide.
Right. So talking about cardiovascular and other comorbid conditions, this is always really difficult for patients living with MS, trying to differentiate what's MS versus other conditions and making sure that those other conditions are accurately identified and managed. And so we're definitely going to dive in here. Next slide. So first, talking about cardiovascular disease. And when we say that, we're really talking about those conditions that affect the heart and or blood vessels. And it's important to address this because cardiovascular disease is the #1 cause of death in the United States. And what we've seen is that it also tends to have impact on MS and that it can worsen MS. So when there is cardiovascular risk factors that are uncontrolled, there's more likely to be MS progression and more likely to be relapse activity. And those cardiovascular conditions that we're talking about here are listed here: hypertension, high cholesterol, tobacco, diabetes, and obesity. So just going through some of these briefly, hypertension is, out of all of these risk factors, the one that's most likely or most commonly associated with stroke. It's the most common modifiable risk factor. And so having high blood pressure identified and treated is important. We talk about part of how it can kind of worsen MS or, disability. And I always try to remind patients that when we talk about lesions and spots on the brain, that's actually not that uncommon. We see it a lot from these conditions listed here. And so just like you have blood vessels all throughout your body, you have small blood vessels in the brain that are more likely to be affected by some of these, some large ones too. But when those small blood vessels get kind of thickened and scarred down, the blood flow cannot get through, and that's going to lead to lesions as well. Not necessarily the lesions directly due to MS, but at the end of the day, you don't want more lesions on top of already having lesions from the neuroinflammatory disease. Hypertension is more commonly seen in MS patients. And so it is important to screen for it and to address it. High cholesterol, again, a risk factor that should be addressed. Tobacco use. We see that when people use tobacco, they actually have more lesions, and the lesions tend to be bigger. And there was actually one study that also showed that with tobacco use, some of the medications maybe work a little differently or not as effective, and at the time going on to progressive MS may actually be shortened. Again, diabetes is really, it can really likes to try to get those really small vessels, and you can see some of that scarring in the brain. And obesity. With obesity, what we see are more MS symptoms, and we also see higher levels of inflammation. So these are just things that when we look at it by themselves, they want to be addressed, but when you add in the impact it can have on MS, it's important to identify and discuss with your doctors. Next slide. So as we understand and manage our risk factors, next, looking at blood pressure. Goal blood pressure is usually going to be less than 130 over 80. I say usually because for some people, they may require something a little different based off of their history, based off of their body and what they require, but that's typically what's recommended for cholesterol, usually less than 200. Again, based on other medical problems, the recommendations are a little more strict, like if you have diabetes, for example. So all important reasons to discuss with your primary care. Next. Smoking, obviously, if you do smoke, we want you to stop. I know it's much harder than just stopping, but looking at different ways to try to stop smoking and discussing that as well with your doctors. Next. Diabetes, we typically want, if someone has diabetes, the hemoglobin A1C, which is going to be that predictor of what the blood sugars are over the previous 3 months, to be less than 7%. A healthy diet, and we just heard about that and mentioned, Mediterranean and DASH diet. And so while there's no MS specific diet, there is a whole lot of literature and recommendations about which diet is best if you have cardiovascular risk factors or cardiovascular disease. So a lot of whole grains, lean meats, lots of fruits and vegetables, and then trying to maintain a healthy weight and exercise. Next slide. So there are so many other conditions that can impact MS, either directly or indirectly. I talked a little bit about migraine before when we were talking about pain, but this can be a really confusing comorbid diagnosis just because of the symptoms can be scary, especially if you have what we kind of call complicated migraine or migraine with aura, meaning that maybe there's a change in a visual aura is very common. So blurring of the vision, which if as an MS patient, if you've had optic neuritis before, that would be very alarming. Sometimes with migraine, you can even get sensory symptoms, a part of your body that feels tingly or maybe even feels weak. And so that's another one to identify and make sure that it's treated, just like you wouldn't want the migraine symptom to be treated as an MS, you don't want the MS to be treated as migraine too. So just differentiating that and ensuring adequate treatment. Muscle and joint disease. So a lot of you have also probably heard that with having one autoimmune condition, you're at higher risk for having other autoimmune conditions. So it's not uncommon that we see a lot of patients that also have inflammatory arthritis, psoriatic arthritis, rheumatoid, lupus, that sort of thing, getting tested for that if there is concern, if there's a lot of joint pains. Thyroid disease is not uncommon. When the thyroid hormone is off, it's going to impact how you feel, energy levels, fatigue. Mood disorders, so depression and anxiety, which are the two most common mood disorders that we see within MS, can impact MS symptoms. And sleep disorders, you talked about that. Cancer, and we're going to talk later on, we'll hear more about like preventive care, but it's important that if you're seeing someone who's entertaining a cancer diagnosis, or if you've been diagnosed with cancer, to relay that information to whoever is treating the MS, because what we also want to make sure is that you're not, receiving chemo immune treatments and then also being on your MS treatment. That can be too much to the body. And so we have to work closely with our colleagues, our oncology colleagues, when our patients are diagnosed with cancer, just to make sure that the treatments are appropriate, or even if that means withholding treatments just from a monitoring standpoint. Vitamin deficiencies are incredibly common. Probably one of the ones we think of most is B12. When that B12 is too low, there's a lot of cognitive symptoms, a lot of fatigue. It can worsen, it can cause a neuropathy and balance problems. And then again, there's so many others. And so it's important to just take inventory of all the different symptoms you're having and making sure there's no other conditions that have not been recognized, and then making sure that you have the correct healthcare team to address it. You can go to the next slide. So that's where we talk about the comprehensive healthcare team. So obviously, if you're living with MS, you should have a neurologist. That primary care physician is going to be incredibly important, especially as it comes to managing your cardiovascular risk factors and monitoring for them. And then as needed, right? So this is where it really looks different for everybody, whether it be a cardiologist, someone that you see for sleep, endocrinology, rheumatology for any of those other autoimmune conditions, mental health professionals. We depend heavily on our rehab team to help us out in so many aspects of care, and then even seeing a dietitian to help with nutrition. And next slide, okay.
Sorry, I was on mute. So preventative care, and Dr. Rosenthal just spoke about this really, because the only way we identify those conditions is through screening. And your champion of screening is your primary care doctor. And so really making sure that you have a primary care doctor that you're connected to and that can coordinate your care with the MS specialist as needed, it is critical. Because like MS, preventative care, the primary care is screening for these things. Early detection will save lives, right? So the earlier something is identified, the better it is in being treated and managed. And so a lot of times in our practice, people will say, "Oh, you're my primary care," and you really do not want neurology as your primary care, right? Because we're not doing a system check and looking to see what your cholesterol is. So making sure you're going for at least yearly screenings, and based on your age and gender, getting those tests, right? And so you see some of these on the screen here. Bone density is really important. We also know people who have had steroids, right, can be at risk for osteoporosis. So making sure that you're getting screened for that. Diabetes, we've talked about the impact of diabetes and really making sure that we're looking at that, right? So if you talk about early detection and you think about diabetes, people can, if you're monitoring it and you're going for screening, they can look at your A1C, right, which is a look back at how your blood glucose has been in the past 3 months or so, and say, "Oh, you know what, we're noticing that this has creeped up a little." And then you can make choices about your diet. If you don't go, right, and you don't have these screenings and you go later, then you've missed a really critical window of opportunity. And so making sure that you're going and having these tests done are so important. Next slide. Yes, I just want to talk a minute about when the ADA, which is the American with Disabilities Act, and why this is important. Because what we have seen is that people who have physical disabilities or functional limitations, sometimes they're not getting screened, right? And so sometimes getting a good exam becomes pretty challenging because a table is fixed and high and you can't transfer or step up onto the table. Or to be able to do a colonoscopy, you need to do some additional prep and it wasn't done. And so the colonoscopy was canceled. And so we've seen that a lot. And this is something that I care deeply about, that we need to start to advocate for change, right? And we're trying, and it looks like the Department of Justice, because the ADA came out 30 years ago, but it's not really reinforced. And so we have to make sure, and what I'm encouraging all of you to do is to advocate for yourselves. Because what we're seeing is that people with disabilities, if you do have some functional limitations, are diagnosed later, right? And with disease or with cancer. And so we want to make sure that everybody, regardless of their abilities, are getting these screenings. And so when you are scheduling, when you are going for your mammography or you are going to see a gastroenterologist, share what you need in order to get a good exam, right? So common accommodation in medical facilities are tables that can go down, right? So
Let's see. So I think we may have just lost Rachel.
to come with the help. The ADA says that they have to provide the help. And so I wanted to make sure that people know that those resources are out there, that you should ask for it. And if you're unable to get that, then reach out. Independent living centers can support that, support you in getting linked. If you're in a large facility, patient relations could be helpful, and also legal aid societies can be advocates for you. So don't settle for no. If you need to get screenings, please advocate for yourself. Next.
And social engagement. So this is our last of our top 10 tips. And it's incredibly important. Interacting with others, having a life outside of the home, or at least out, even virtual. But what we know is that with improved social engagement, we see benefits to the mood, we see the cognitive benefits, and we even see improved physical outcomes. Isolation really can lead to the opposite of everything, a lot of depressive symptoms, not doing as well physically. We saw this a lot with the pandemic. Unfortunately, our MS community really took a hard hit because of the ways that I feel like a lot of patients were able to engage socially got shut down. And so that, in combination with some maybe mobility issues for a lot of people, really did lead to isolation, a lot of mood changes, a lot of physical declining. So finding ways to engage with the communities is important. Next slide. So here are some examples. And again, there's a link between social engagement and cognitive health. So really important, but employment. Employment is a way, obviously, you have to work with people. You're engaging and you kind of have a life outside of what you may have at home. And again, this is not unique to MS, but people who retire, for example, whether you retired because you were of age or you retired due to a medical issue, going from working regularly to not can be a huge difficulty that a lot of people face, and having to adjust to and to find other ways to interact with people. Volunteering can be helpful, joining different clubs. And if you can find a way to interact socially with people that also is doing some sort of cognitive task, that's great. So like book clubs. And even if you can't necessarily maybe read a book because of a vision issue, for example, doing an audiobook, and you're still having to focus on that and use your cognition to interpret everything. But that's another one. Clubs, different organizations, fundraising. There are a lot of various online communities as well, so that you don't necessarily have to always leave the home, but you're still interacting with people virtually. Community gardening, mentorship programs, and then I said family gatherings. And I know everybody has different feelings about their families and family gatherings, but just engaging with the people around you, your own support system. If you don't have family, and unfortunately not everybody has family that's necessarily supportive, then it does take some time, but it's important to kind of build your own community of people that you can interact with and talk with. All right, next slide.
And our next slide is our Q&A slide, but I will kind of jump into the end of what Jackie was just saying there. Here at Can Do MS, we would love to be your community. So please join us for programs. You're here on tonight's webinar or maybe watching the recording later. Check out some of our in-person programs as well, called community programs, and also our more interactive virtual programs like our jump starts or our coaching series. We'd love to see you at any of those and jump in as part of our community here at Can Do. Now back to Rachel and Jackie here. Wow, we talked about a lot in a short amount of time. So thank you both so much. I think we talked about a lot of tools for our tool chest and just things to consider. We have a lot of great questions, so I want to jump in and shoot a few your direction. So to go back to pain, one of the first things that we were chatting about, who can we see for that? What kind of healthcare professionals would be helpful when it comes to pain management?
Yeah, so this unfortunately varies because not everybody is as comfortable with treating pain, and the way pain is treated has shifted a lot in the last few years, especially if you watch some of those Netflix documentaries out there. But definitely you would start off with your primary care and your neurologist, and it depends on the source of the pain, right? Obviously, if we kind of are linking it in to something that is more closely associated with MS, your neurologist should be very comfortable treating that kind of pain. If it's something that maybe is unrelated, if there is another issue that's causing pain, that may have to go through your primary care. And if you don't know, you just bring it up and you talk about it. Um, if there's a joint issue, for example, that needs to be addressed, that may mean that an orthopedic specialist has to take a look at you. If there's something internal that, and maybe a workup needs to be done to figure out maybe where that belly pain is coming from. So we don't always just want to kind of skip the what's causing it. We do want to make sure that once all of the things have been done to look for that workup, that the pain is being addressed. Pain clinics, oftentimes pain or pain and spine clinics are who really get into the aggressive treatment of pain. And so when you've kind of exhausted the possibilities with your neurologist or your primary care, and it's just solely a pain issue, that is where you would see the pain clinic. And I just saw a comment that this says the cause of the pain was never found. And that's unfortunately a really common occurrence. Sometimes we can't always pinpoint it, but that doesn't mean we don't still try to treat it.
Awesome. Thank you for that answer. And then talking about cognition again. So a couple of questions. How common is it? What percentage of people with MS typically experience cognitive issues? And then what cognitive assessment tools do you recommend?
So the percentage, and Jackie, jump in if I think research varies. But I think it can be up to 70% of people say they have some form of cognitive impairment. Yes, okay, you
Yeah,
guys are
it's
agreeing with
like
me here.
40 to 70. Some
Yes,
studies say
yes,
40. It's a
yes,
lot.
yes.
You're
So
not alone, everyone.
yes. And so so a neuropsych is probably the most thorough assessment that is done. We have different digital modalities that we will do in clinic, but it's really to screen, to know your baseline, and then the depth. That's what I was trying to say. Like, if someone's reporting, right? So when you guys probably all know this, we ask you a million questions when you come in for a visit, right? We're trying to see has anything changed. So we do initial screenings, and then if something's coming up and you're reporting struggling, we really refer to our colleagues. So neuropsychological testing is kind of the gold standard. However, insurance doesn't often cover that, or it can be challenging to find a provider. And so we also rely on, and they are very good, our speech therapists and occupational therapists can do screening and assessments and treatment as well. I don't know, Jackie, if you have anything.
Yep,
Okay.
agreed. Yeah.
I'll shamelessly plug May. We'll be talking about mood and cognition in our webinar, so please join us in May again too for a deeper dive. Let me skip down to this one. So exercise. We had a number of people that mentioned, I don't have the mobility, I struggle to walk to the mailbox, or I can't, walk a dog like you can. I think there's other exercise options out there. So I did want to just point that out. We have a variety of chair exercises as well, but Jackie, Rachel, if you guys have any comments there, I'd love anything that you want to comment on or share.
This is where our physical therapy colleagues can be incredibly helpful. I send a lot of people who are just kind of like, I don't even know where to start or what I should be doing, what's safe for me to do, to physical therapy, because you can kind of get that initial exam to see what your capabilities are, and then really some guidance on where to start. and the tools that you need to then kind of incorporate at home. And that may be that you see a physical therapist. MS is unique compared to some other conditions where you may see a physical therapist multiple times over time to get fresh eyes and to kind of get some more recommendations as your mobility changes, whether it be in a favorable or unfavorable way.
That's great. Yeah, our PT and OT friends have a lot of tricks up their sleeves and ideas, so that's great. And then, so also, let me scroll back up here. Acupuncture. Do either of you know anything about acupuncture or other ways that it's used to help treat MS symptoms?
We think about our, acupuncture as, complementary and alternative medicines. And it's not something that, we get a lot of training on in our medical education here. So it's something that we definitely have to look into separately. I can just say anecdotally, what I've experienced with my patients is that it's very hit or miss. But in the patients that it works for, it's not something that they just do one time. It's something that they're doing continuously. But I always say if you are able to do it, it's something that a lot of patients maybe have pay out of pocket for. And so if the resources are there and it's helpful, then by all means, I would continue to pursue it.
Okay, great. And then very last question. Someone asked earlier about DMTs. Why would you go off a DMT?
Yeah, I'm glad you saw that because I saw that too.
Thank you.
So there was, some research that came out before that kind of said, if you're a certain age and you've had MS for this amount of time, that you maybe you don't need your disease modifying treatment. Or that's how it was kind of, I would say, interpreted by a lot of patients. And the whole point of that really is when I showed that slide where those relapses and the active disease are happening early on, it does slow down. Most people that have had MS for 30, 40, or 50 years don't really require the disease modifying treatments because the disease itself is no longer active, meaning that you're not having new lesions and new inflammatory attacks. And at this point, our treatments, that's what they work best at. And so it doesn't mean that you're not having ongoing symptoms or even progression. But really, especially as someone ages, we really have to be mindful of the risks from the treatment and the benefits. And so if there's going to be a lot of risk with being on immune treatment and little to no benefit, we may consider taking someone off treatment. That doesn't mean that you don't still have your symptoms treated, and it doesn't mean that you aren't still monitored for active disease, but it's a very individualized situation that has to be kind of taken on a case-by-case basis where you discuss it with your neurologist because everyone is completely different.
Okay, great. Well, I think that's a great place to end, and we are 1 minute till the top of the hour. So please stay in touch with us. We'd love to stay connected with you. Next month, we're going to be diving into the topic of employment. So working with MS, your rights, disclosure, decisions, and accommodations. We'll have 3 programs next month, this webinar, our Jumpstart program, and then a Q&A session as well, our YQA. Again, I want to thank our sponsors. Most of all, I want to thank all of you for being here. Thank you so much for participating in this program. Thank you to Rachel and Jackie for being here and guiding us through tonight's presentation and some ideas about how to stay healthy and well with MS. Last ask of all of you, please complete our survey tonight. As I close the webinar, our survey will pop up and we would really appreciate your feedback on tonight's topic. And thank you so much again for being here. Have a great day, great evening, everyone. We'll see you next time.